Okay, thanks a lot. Glad to be here, and we're continuing to figure out exactly what this is. With this is a technique that we've developed in response to an actual community situation in Wisconsin, and then we realized that it seemed to be fruitful in maybe some unexpected ways and some good ways, and we're still trying to understand ourselves what seems to work about it and what appeals to people about it. My research interest, or my interest, is I'm a sociologist, and I've been in many interesting incarnations as a result of that. But one of my, including a kind of a pure academic life, and interested in theory and methodology for its own sake, and sort of teaching people about that. And I've always had an interest in qualitative methods as well as quantitative. And after doing a sort of traditional academic position, actually at the University of Lethbridge for 10 years, I went down and joined the Faculty of Medicine at the University of Wisconsin. And that's a long story, but it was a very good experience. And I was there for about 5 years, and I was working with healthcare providers, primarily family physicians, working with on issues of how they worked with their patients, how they worked with their communities, quite a wide range of research. And that kind of pulled me into the health area much more than I had been before. And while I was down there, an opportunity came up that I'll tell you a bit more about as we get into this, but to work with one of the local communities. And that experience led into the development of participatory photo mapping, particularly after other colleagues came in and joined. And so that was really good experience for me for working in that interdisciplinary setting. In 2006, I returned to Canada, and I'm now at UBC, and I actually, for the last few years, I've been working for the Provincial Health Services Authority in the mental health and addictions area. So a lot of my own policy work and research is in the substance use mental health area. And then I'm housed in the Child and Family Research Institute, which is in a sense a wing of UBC with a focus on health research. So that's where I'm at. And Suzanne will tell you a little bit about her interests, which in some way are more compelling. But that's where I'm coming from. And I like to, I guess, think of myself as a methodologist, but also as someone that wants to see the kind of work that people like me do make a difference somehow, and but also in a way that isn't doing it for people, but it increases their capacity to improve their situation themselves. So, which sounds good, but isn't necessarily straightforward at all. So I'll walk you through the overview here. So we have something we call participatory photo mapping, which I'll say right away is something that we think of as distinct from photo voice, and maybe later we can talk about that. But we don't see it as, we certainly see it as more than photo voice. And we see it as something in relationship to the environment, so it's about environmental health. And we see it in the context of doing community development around what we might broadly call environmental health issues. So people in communities working towards improving, reaching their aspirations in terms of their environment and as it relates to health issues, safety issues, and using participatory photo mapping as a kind of a vehicle for that to some extent. So, okay, what I should do is acknowledge right away that this is a technique that developed out of work with a particular community, and in order to respond to what the community felt that they wanted, I had to bring in 3 colleagues from the University of Wisconsin, and I'm just going to acknowledge them right now. There's Sam Dennis, who's in the Department of Landscape Architecture at UW-Madison. Suzanne, who you'll learn a lot about soon, who's with the Nelson Institute and at the same university. And then Rich Carpiano actually was at the time at the UW-Madison as well. He's also a sociologist. He was there on a Robert Wood Johnson Health and Society Fellowship. And we managed to corral him into working with as well. And these individuals actually are the ones that did most of the on-the-ground work with the community. And this is where it's important that Suzanne is here to kind of help do this workshop today. Rich somehow followed me Vancouver when I came back to Canada, and actually now is at UBC. So if you're interested in some of his work, he's close at hand. So Sam brought in expertise in mapping and working with communities in terms around mapping issues, and Suzanne will be able to tell you about her quite wide background. She has a background in anthropology, which is one of the many things that were important for us. Rich, when he is doing qualitative research in sociology, specializes in something we call walk-along interviews. So going with youth and interviewing them as you walk through the environment. And that's one of his specialties. So it's a pretty wide range. My role was essentially to be a broker for a large extent and kind of work with the community and kind of help my colleagues make sense of what we were doing. So participatory photo mapping, I'm going to stop saying that because it's really a long phrase, and we'll just say PPM. We just refer to it with each other as PPM, and we actually, I think yesterday at some point made it a verb. We were talking about getting people to go out and PPMing, and that actually kind of makes sense. So I'll use PPM, but I'm referring to participatory photo mapping. I guess where we're coming from, the four of us in this is having done that work in Wisconsin a few years ago now and continuing to work on it. I guess our overall goal is not so much to do more of these projects ourselves, although we'd like to do that, but to kind of have others who are interested in picking up the ball and running with it and improving the process and innovating something that we've started. And again, to do collaborative projects that support community development in a certain sense focused on environmental health. I think that's where we think this is the most useful. PPM can be thought of initially as, from a strictly methods point of view, as an integrated set of tools that people can use to explore their lived experience of health and space. And I'm going to say a little bit more about that mouthful, what lived experience means for us, and for communicating this experience to other decision makers. So they're decision makers themselves, but in some cases to leverage change, for example, in the community, they may have to be able to influence other decision makers as well. So public health officials, provincial or state kind of officials that make decisions that affect the built environment that people live in. Using PPM, we find, helps people to uncover opportunities, but also barriers related to healthy daily living and barriers that are related to the nature of their built and social environments. So it's a way of kind of getting a handle on that, and more importantly, that they can get a handle on that. It's well suited, we find, to participatory community-based health initiatives. So health initiatives where you want to engage people very much in the process. Okay. We've got I guess a kind of a philosophy about working with communities, about what community-based research is, and there's a lot of people now who are trying to do community-based research, and we decided it would be useful to kind of set out a little bit about what that meant for us. And what we think that it means is a bit of context for talking about PPM is doing community-based research means that there's a particular community, but there's a community setting. Right, there is an environment, they're in it, right? You could go to it, probably, and if you're working with them, you should go to it. You will be in it, and they're in it, and they're part of that environment, and it's also the built environment, natural environment around them. So it's where people live, work, study, right? So we're in one right now, in a certain sense, for a certain population. My neighborhood's one, your neighborhood's one, so on and so forth. This kind of research, we think, ought to generate findings that people in that setting can use to improve it from their point of view. Okay, so it's community development in that sense.